In the room where his wife Wendy died, Peter Buckle keeps a box of memories. She was 54 when a brain tumour was discovered. 4 precious months slipped by before a doctor thought to mention that her death was imminent. During her final days and hours, she was repeatedly let down by different parts of the healthcare system.
It is not joined up. There is not this coordination of someone who has the responsibility and the authority to put a complex package of care needs together in a seamless way, rather than leaving a complete amateur to try and muddle their way through when you're in a fairly desperate situation. I was Googling how to dress my wife's pressure sores, and I did feel rather abandoned.
Today, the Health Service Ombudsman published a catalogue of complaints, including doctors making 14 attempts to insert a drip during a man's final hours, a daughter discovering her dad was terminal before he'd been told, and a mother forced to fetch a doctor from another ward for her dying son.
People are dying in pain and distress because their pain isn't being managed. We found there's poor communication between staff and families and patients, and so people aren't able to say goodbye to their relatives or come to terms with their death before they die.
NHS England says last year it did adopt a new approach which stresses early planning and respect for the dying person's wishes.
We really need to make sure that people are able to talk about it openly, to express what it is they want as they near the end of their life, and that those of us that are responsible for both commissioning the care and then providing it can put that care around the individual patient and their families.
This was our last ever holiday.
Only 1 in 4 deaths are unexpected. For the rest, there is time to get it right. Yet too many people are experiencing needless suffering at the end of life, suffering that also stays with their loved ones for years to come. Catherine Jones, 5 News.